Hi all, a very good evening to one all. Am I audible?
Yes,
Yes,
you're
sir.
Yes, Joel.
Great. So once again, hi to everyone. So we'll be having our second day of internship conducted by Nimisha Kumar, ma'am. So she'll be going on towards the session regarding clinical psychology. So I hope people have been doing the internship assignment that was given yesterday, where we asked a lot of few questions to do the assignments, and also we'll be adding the new people who have been joining right now in the Google Classroom so that you guys get updated and also submit your assignments on time. So I'll ask Deepak to give ma'am the proper introductions and start with the session. Go ahead, Deepak.
So good evening, everyone. Am I audible?
Yes.
So am I audible? Yeah. So thank you, everyone. I am very grateful for having this opportunity to welcome Nimisha, ma'am. So she is an experienced psychologist and she is skilled in psychological assessment, cognitive behavior therapy, behavioral science research, teaching, and training. She is a professional with Master of Philosophy and PhD in clinical psychology from Department of Psychology, University of Delhi. Now, and she's currently founder of Psycare, and she is currently having her own setup named Ascent Saika, also working as associate professor at SGT University. I'm very glad to welcome you, ma'am, and I hope we will all learn a lot from you. So can you take up from here, ma'am?
in any internship, quite honestly, today. Because what can you do as a 16 or a 17-year-old normally as an intern? As IMON, we are entrusting you with an entire state.
Sorry, ma'am, there's a connection problem. You can continue, ma'am.
Yeah, yes.
Ma'am, please unmute yourselves, ma'am.
right. Okay now?
Yes, ma'am. Perfect.
Right. So I was saying we'll have an interactive session on what is clinical psychology and the basic introduction to clinical psychology. So I got to know that all of the participants are students, masters and bachelor students. And like I would like to ask all of you what not all of you but at least one or two of you as to what you think psychology is. I mean, what is your favorite definition of psychology? Anybody, just one or two? Anybody would like to say something?
Study of human behavior.
Yes, yes, perfect. That's very correct. So, psychology is the scientific study of human behavior, right? So, it is a science, and in Western countries, psychology is a science subject, while in India, it's considered an arts subject, right? So, psychology is the study of human behavior, and when the setting is a clinical setting, setting means to do with a hospital or a clinic, or where there are people with mental health concerns, issues, any illness. That is what becomes clinical psychology, right? So the entire subject matter becomes specialized to the clinical area, and that becomes clinical psychology. So I would just like to share my screen with you. So let me just figure out how to do that. I'll be able to share my screen, right?
Yes, ma'am. There is a share screen option in the
Yeah.
bottom.
Yeah, just a second.
Yes, ma'am.
Okay, you can see that? Is it visible?
Ma'am, it is visible.
It's visible?
Yes, yes.
Okay. Okay, so I was talking about clinical psychology and what clinical psychology is. So clinical psychology is basically, it's a specialized area of psychology. It's in fact an application of psychology in the field of clinical expertise. So it not only tries to provide individuals but also families and communities with good and comprehensive mental health assessment as well as treatment, right? And it is also involved in the field of academics and research. So when psychological knowledge and principles are applied to the clinical setting, that becomes clinical psychology, right? And it is, like I said, it's an applied area, it's a highly specialized and complex area, and it also has a lot of diversity in it. So in India, it's almost been more than 100 years that clinical psychology has been in existence. And like, if all of you know, clinical psychology began with the establishment of psychological laboratories where a lot of experimentation was carried out to understand behavior. And that was, these experiments were done on animals, and then they were generalized to human beings. But clinical psychology is known for its focus on assessment and evaluation, right? But the aim is to apply the science of psychology for prevention, assessment, diagnosis, and treatment of a variety of complicated mental health concerns, right? So earlier, the typical scope of clinical psychology was stressed to be on assessment, evaluation, and diagnosis, right? So the assessment of clinical conditions, mental health conditions, their evaluation, as well as their diagnosis. But since quite a bit of time now, the focus has now moved towards intervention in the form of evidence-based therapies. So you would have heard of psychotherapy, and that is also in the domain of clinical psychology, right? And also teaching as well as research. So I'll be talking about more in detail about these a bit later on, right? So then when we come to the role of a clinical psychologist, the role of a clinical psychologist is, first of all, to understand normal psychology as well as the abnormalities that exist or the deviations that exist in psychology or human psychology. So all of you would have seen these clinical psychology books, and they are often called as abnormal psychology, right? So abnormal psychology is now not a politically correct word, because actually there is nothing like normal and abnormal. It's, everything is on a continuum, right? But these things have been carrying on since traditional times. But what is normal and what is abnormal is a very, very subjective kind of an understanding and assessment, and it is often based on society's standards, right? So what is normal in one society may not be normal in another society. So there is a variation in this. So abnormal psychology is not really the correct term, but the whole idea behind saying abnormal psychology is that anything which does not fit into the expected, into the so called normal, is considered as abnormal. Okay, but clinical psychology is a better term, and clinical is a better term. Clinical means that when the person is in throes of a mental health condition so much that it halts the person's functioning and creates a lot of problems in life areas such as interpersonal, occupational, and personal areas. So when the person becomes sort of dysfunctional and has to be admitted to a hospital or has to take medication or treatment for it, that becomes a clinical condition. And these things, these people are mostly found in, obviously, clinical settings, which are clinics, hospitals, and a lot of institutions which deal with mental illnesses and mental health, right? But what is the difference between a clinical psychologist and a psychiatrist? Anybody knows? There's a lot of confusion in the lay public, usually the general public, about what is a psychologist and what is a psychiatrist. Anybody can point out?
Yeah, clinical psychologist, yeah, the counseling psychology deals with behavioral changes, whereas clinical psychology it deals with something more intense, ma'am.
Right. So I was asking about psychiatry and clinical psychology, right? So,
Okay, yeah.
so I would like to show you this continuum. You can see this continuum here. It's a mental health continuum, normality, abnormality continuum. So on one side, you will see are the mentally healthy people, and on the other side of the continuum are psychiatric disorders, right? And you will see that the arrow is not ending. It's like extending into both directions. So the idea of this mental health continuum is to bring to the fore the understanding that human psychology and especially mental health issues, they are on a continuum, and it's a very dynamic kind of a field. So for example, like I said, what is considered normal in one society may not be normal in another, and a person who is considered abnormal at one point of time may not be abnormal at another point of time, right? So it's a very fluid, it's a dynamic situation. But people who are functioning well in their life, the key word is functioning. So people who are functioning well and who are fitting into the society's roles and what is expected of them, right, are said to be mentally healthy. And also these people don't have so called any distress, which is very evident. When you move on from mentally healthy people, there are obviously most of us who are having daily life stresses. Okay, so especially in urban areas, everybody is aware, and maybe now also in rural areas, there is so much stress in our life. Stress means that when the demands of our life and our environment are so much that our psychological, physical, social, resources are not enough to deal with those demands, and we feel a sense of pressure, we feel a sense of discomfort, distress, and that can be called stress. So all of us deal with a variety of stress in our everyday life in various domains: personal, interpersonal, social, right, spiritual. So whenever there is stress, it obviously disturbs our mental health. But stress comes and goes, right? It changes with the demands of life and also with your health. So physical and psychological health and stress, they have a dynamic relationship, right? You move on further in the continuum, then there are psychological problems. So these are more chronic, they are longer in duration, they are more frequent, and they may be disturbing the person's functioning to a large extent, right? But still the person may be functional, able to carry on with a job, or take care of the demands of the family and society, although there is distress. Okay, but psychological problems can be dealt more by counseling. So you would have heard the term of counseling psychologist or counselors, and they are the people who are trained in mental health and psychology, but they deal more with these psychological problems which have not yet reached the clinical stage. So it may be non-clinical or subclinical. Non-clinical means when it's not severe or chronic enough to require hospitalization or medication, but it is sufficiently distressful for the person. So counseling psychologists and clinical psychologists are distinguished by the scope of their work, right? So while clinical psychologists deal with the more severe kind of disturbances and intense mental health issues and illnesses which require hospitalization, medication, very active and prolonged intervention, while counseling psychologists deal more with the emotional and psychological adjustment issues of people which are distressful, but which may not require medication as such or very long term intense psychotherapy, right? So the mental health continuum is a helpful way to look at mental illness and mental health, and and it also helps in understanding the role of a clinical psychologist. Also, how is a clinical psychologist different from a psychiatrist? That is a very important question, and a lot of the lay public are often confused about this. So anybody training to be a clinical psychologist must know these terms very clearly and should be able to distinguish and also share relevant information about this with your family members, your friends, and members of the lay public, whoever you come across, right? Because since you all are training to be, or not all, possibly a lot of you are training to be clinical psychologists. So I think it is your primary responsibility to first of all be aware yourself and then spread the right kind of awareness around you. Okay. So psychiatrists are basically people with medical degrees, MBBS and MD, and they have specialized in psychiatry or the study of psychological problems, psychiatric disorders, and their treatment through medication. So it's not that psychiatrists don't engage in therapy, in psychotherapy. They do, but in a limited way, right? And most of their work is towards psychiatric intervention with the help of medicines and other procedures. And obviously, they are dealing with the clinical population, people who are severely mentally ill enough to require hospitalization, medication, or other treatments. Like there used to be electroconvulsive therapy, shock therapy, which is, I think, one of the reasons that the field of psychiatry and clinical psychology are quite stigmatized, and they continue to be. But to a large extent, that has been taken care of, and ECT has very specific uses and very limited uses now, right? And okay, so clinical psychology and mental health. So when we talk about clinical psychology, it's not that they only deal with intervention, they also deal with prevention, right? So they deal with various assessments, maybe like neuropsychology, forensic assessments, clinical assessments, right? And they are also concerned with prevention and health promotion, right? So in various studies, they have pointed out that clinical psychologists can be in the role of testing, which is mostly diagnostic testing, psychotherapy, teaching, research and writing, clinical supervision, consultation, as well as in administration, right? So clinical psychologists can be in a variety of roles, but all within a clinical or even a community setting. Okay, if we talk about the training of clinical psychologists and how one becomes a clinical psychologist, so in India, mostly there is a bachelor's, people do a bachelor's degree in psychology, a BA, BSc, or a BA honors, in which, they may study clinical psychology as one of the papers, but mostly, like, when we are in school, we study all the subjects till class 10th, 11th, right? Similarly, in bachelor's, people would be studying a variety of papers, of which clinical psychology may be one. Now, in some universities, specifically, they have started with undergraduate programs in clinical psychology per se. So they have more content of clinical psychology, in the course. But mostly after a 3-year bachelor's degree, people move on to a 2-year master's degree in psychology or in clinical psychology, whatever they may choose and whatever they may be able to get through, right? After this 2 years master's program, most people who are wanting to be clinical psychologists have to undertake an MPhil program, a Master of Philosophy in Clinical Psychology, from one of the RCI and RCI recognized centers, institutes, right? So there are a variety of centers in India which offer MPhil programs in clinical psychology. In addition to MPhil program, there is also now a 1-year professional diploma in clinical psychology, which people can do, but which makes you a clinical psychologist, but which not, it does not, make you get into teaching jobs in clinical psychology institutes, right? So you can practice. If you are in practice, if you're wanting to do clinical practice, you can opt for that 1-year postgraduate professional diploma in clinical psychology. Okay, after this you can pursue a PhD in clinical psychology. Some people choose to do that, which is 5-year, 4-year program. Or there is also now a PsyD, Doctor of Psychology program in clinical psychology. It is a recent addition in India, a couple of years back, and it is quite prevalent in United States and other Western countries, right? But we are more familiar with PhD in clinical psychology. So the journey of being a clinical psychologist is usually this path: a bachelor's, master's, then an MPhil, and maybe then a PhD later on if you want to especially get into teaching. Okay. And a lot of internships may be taken up in between. So a lot of students these days want to do internships during their bachelor's also and masters to upgrade their practical skills and to get to know about the field, right? So internships are a good way, as also are workshops, webinars, of increasing your knowledge and being up to date. Okay. So clinical psychology in India has also really advanced. It has come a long way. And the role of a clinical psychologist earlier used to be quite limited and focused on assessment, psychological testing, right? But now it has really diversified, and clinical psychologists are known for interventions. Assessment obviously is there, diagnosis and assessment, then intervention, and now a lot of people are also getting into academics and research in a big way. So when you start working in a university as a clinical psychologist, you are expected to engage in academic work, which is teaching and research. As opposed to this, if you are working in a clinic or a hospital, you might be getting only the practice side of it, right? And also you might be training students, teaching, taking people for internships, but all towards the practice of psychology and not really teaching like happens in a university. But the scope of clinical psychology has tremendously increased, and in a lot of universities they offer an applied psychology program. And applied psychology is basically into three areas, or till now it has been. So one is clinical psychology, definitely. The second one is industrial or corporate or organizational psychology, and the third one is counseling psychology. And now a lot of universities are also offering forensic sciences, forensic psychology as an option. But clinical psychology is usually derived from an applied psychology kind of a background, right? Because it's application of psychological principles in the clinical setting. Okay. And now, along with the diversification and kind of improvement in the role of a clinical psychologist, there has also been a side by side a more awareness about psychology, about mental health issues. And a lot of people have been talking about opening up, and really talking about mental health concerns and removing the stigma. So, as mental health is becoming more popular, the role of clinical psychologists is really increasing. And you would know that clinical psychologists in India are extremely few. In fact, psychiatrists and clinical psychologists are very few, and compared to the enormous population that we have in India, especially in rural India, the mental health professionals, such as trained clinical psychologists, are very, very few in number. And every year, only a few um, tens of psychologists are getting trained and starting work. Okay, so there is still an enormous scope in this field, and I think that is one of the reasons that you have taken up this topic today for this webinar. Okay, so in terms of work environment, I have pointed out earlier also, but more in detail, clinical psychologists usually work in hospitals, health centers, and clinics, and a lot of them are also into practice, independent practice, self-employment. Okay, they also work as a part of mental health teams and within social services. Okay, and social care settings like community health centers, and even some NGOs, right? And clinical psychologists are also expected to work closely with other health professionals. For example, there are sometimes multidisciplinary teams which are there within institutions, and for example in the field of early childhood development and early intervention, where they work with very young children, there are usually multidisciplinary teams composed of nurses, physicians, pediatricians, occupational therapists, physical therapists, so special educators. So psychologists work in combination as a team with these people to provide a holistic, approach to the people that they are working for. And sometimes when they are in private practice, they may choose just to be in practice, or they may also choose to be in training and research, like I am. So I am not really, I no longer call myself a clinical psychologist, because I am from one of the old times when the MPhil program was not so popular, and it was only there in few institutions. So I am from the applied clinical psychology background. So I have done most of my training in the third year of my bachelor's degree, where I was in a 1.5 year placement in the GB Pant Hospital in Delhi, and I have trained there, in the clinical field. But like I said, I'm an applied clinical psychologist and not really the MPhil clinical psychologist, right? So but I have experience of working in a multidisciplinary team, as I was telling you, in early intervention. I also have experience in working with my own practice, independent practice, in which I specialize with cognitive behavior therapy. I'll talk more about it a bit later. I am also into training and teaching, psychology students and other professionals. And I'm also into research. So clinical practice, training, teaching, research, right? These are the main roles that a clinical psychologist is into. Okay. And they may be working directly with patients and clients, or they may dedicate themselves to more indirect routes, such as research and academic work. Okay. Okay, so clinical psychology is an upcoming, it's no longer even upcoming, it's quite an established profession, in fact. And there's a lot of demand for clinical psychologists, like I said, in India and also the world over. But clinical psychology is a challenging profession, right? And challenging because of the nature of the work involved. So it's not only that the person is sometimes overworked. So clinical psychologists, because they are fewer in number and there is a big patient load, so they might have a lot of work fatigue associated with their job, where they are seeing a number of patients in the OPD and wards, also teaching and training, assessments, into liaison work, into teamwork, into research and teaching. So sometimes they can be overwhelmed, like any other professional. But the unique aspect of this kind of a profession is that you're dealing with mental health concerns, and you have to be extremely mentally healthy and fit, and also be very good in self care. So you have to debrief, you have to be sensitive to your own mental health concerns and needs. So also there is something called a compassion fatigue, where since we deal so much with other people's issues and problems, and we try to put ourselves in their shoes and try to understand their problems, which is called empathy, there may a time come when you get into compassion fatigue, in which you are almost tired, have a burnout in terms of dealing with people's problems. Okay. Also, since the field continues to be stigmatized to a large extent, even within professionals, so there may be professional isolation also. So a lot of clinical psychologists are working in teams and in hospitals, where they may find themselves isolated from other health professionals, right? Especially there is always a competition with psychiatrists, right? That clinical psychologists go through in a lot of institutions. Okay. And even within their own teams, there may be competition, and there may be politics, which leads to professional isolation at times. Also, it is a challenge in balancing personal and professional life. So sometimes, work comes back home with you, and with this kind of a work life where you're involved in dealing with people's problems and emotions and everyday, concerns, as well as, intense trauma, intense mental health, and emotional issues, it might take a toll, on the person. And sometimes, due to the enormous amount of work, it may lead to a difficulty in balancing, their own personal life, and sometimes the people feel burned out as a result of this. Also, clinical psychology requires a long period of extensive education and training. So a 3 plus 2 plus 2 is definitely there, but an MPhil is just a starting point of a clinical psychologist's career. Okay. And when you are training to be a clinical psychologist in MPhil, you only get like bits of training in each and everything. So most people, when they come out into the field and when they are face to face with their jobs, they realize that it's not so easy, and they need to update their professional knowledge and experience all the time to be able to deal with the demands of the situation. So it's not that after the MPhil your journey ends, possibly it just begins at that time, and you constantly need to update your knowledge and information as well as your skills, right? There is also a possibility of patient violence sometimes, and because these people are suffering with mental illness and mental health difficulties. So patients as well as their relatives, because of being stressed, they often are capable of taking out that frustration onto the psychologists and the doctors working on the team. So there is always this possibility, and especially with patients who are psychotic, like people who don't have touch with reality, right? People who are schizophrenic, or there are other variety of psychotic episodes, briefer ones, or they are into kind of persecutory delusions and suspiciousness. They are people who are quite possibly capable of violence as well with the doctor. And also, a lot of time, people with dementia and memory issues or personality issues are also can be dangerous to themselves as well as to other people, doctors around them. So that is also a stressful thing, right? It's a challenge to be able to deal with this kind of a situation, especially it is quite prevalent in hospitals where there are wards, and where there are people admitted with mental health concerns. Okay. And emotional strain and burnout is obviously, as we've talked about, it's a big challenge in the field of clinical psychology. Okay, now in all of the professions these days, and especially during the pandemic, it has been realized that technology or the digital divide is a big issue, right? So there are a lot of us who are very familiar with technology, and we find it very easy to work with technology, but a majority of us still are technophobic, and we are having trouble in kind of dealing with the whole bombardment of technology that has happened during the pandemic in terms of online therapy, online teaching, training, online webinars, conferences. Okay. And it is very important for all of us, especially clinical psychologists, to become comfortable with use of technology, because this is the future we are faced with. So it's not going anywhere, it's only going to increase with artificial intelligence coming on, machine learning, big data management, all these things. So even clinical psychologists have to update and upgrade themselves and become familiar with the use of technology and technical equipment as well. Also, since psychologists, clinical psychologists are in a big way into assessment, psychological and psychiatric assessment, they need to be comfortable with computer based, web based, and online assessment procedures. Also, it is very important to maintain ethical and professional standards, right? So this is a field where you are in charge of somebody's life. It's a people's profession, like all doctors are. So it's a very honorary role, and it's a big responsibility. But because it's a big responsibility, you have to be very careful about ethical practices and about being completely skilled in whatever you are doing, right? Because it might negatively impact the person and the persons you are dealing with, or even their families and the community. And it can also have a negative impact on the reputation of the profession. So ethical practice and knowledge of professional codes and conduct are very, very important. And uh, in India, the Indian Association of Clinical Psychologists, IACP, is the premier body which deals with clinical psychologists. So most of the clinical psychologists are members with the IACP, and they are responsible not only for the regulation of the profession in the country, but also in networking and in spreading the knowledge and awareness about clinical psychology. Okay. So there are various new directions in the field as well. So there is now a lot of focus on competency in training, especially evidence-based therapies. So evidence-based therapies means which have been established by research to be efficacious, and which have been established as really making a significant difference in the condition, whatever the intervention is being done. So, cognitive behavior therapy, or CBT, is one of the major evidence based therapies and techniques which are there. There is also constant change in the accreditation procedures and the requirements which are there, in terms of upgrading your skills to be able to get the license and keep your license to practice. So the RCI program in clinical psychology makes it mandatory for all clinical psychologists to earn about 100 points in 5 years to be able to continue with your license as a clinical psychologist. Okay, there are obviously all the time there are new developments in the field. So new things are coming up all the time in terms of mental health, character the classification of mental illnesses and diseases, in terms of medication and intervention procedures, diagnosis procedures. So one has to be constantly updated with the changes and the new knowledge in the field. And it is a big responsibility, so you have to constantly evaluate yourself as to where you are in terms of your work and how well you are able to deliver your skills on for the benefit of the people you're working with, right, working for. And like I said, there's also an extended role for technology, internet in service delivery, so one has to be comfortable and familiar with that. Also, psychotherapy requires that you enter into a lot of positive psychology based work as well. So psychotherapy does not really end with the end of mental illness. After that you might be dealing with people who really don't have a mental illness, but you are in the role of rehabilitation, or you are in the role of upgrading their mental health and making them go towards positive mental health. So you have to be constantly updated about newer developments in the field which can enhance not only the treatment of mental illnesses, but also enhance personal growth and adjustment of the person in this field. Okay, so that's the end of my PPT. And so now I would encourage all of you to ask questions so that we can make it into an interactive session and I can answer your queries.
Um,
Right?
Hi, good evening, ma'am. My name is Tanushree, and I recently joined my course, Masters in Psychology in Punjab University.
Mm-hmm.
And just a second. And I'm hoping to take clinical psychology as my major in second year. But I was quite sure about taking the same. But listening to my teachers and different mentors, they said that okay, it's not very simple and all that stuff. So I just I just wanted to know what a typical day in the life of clinical psychologist looks like or feels like.
See, this is a very good question, but again, it depends on the kind of setting you are working in. So, like I talked about, that clinical psychologists can work in a variety of settings, and if you are into clinical practice, right? So you will be dealing directly with patients, with people with mental health concerns and problems. So that your day would look like that, where you would be doing some assessments and doing a lot of therapeutic work, psychotherapy work, if you are into clinical practice. Also, ideally, it involves a lot of paperwork, also documentation, maintaining clinical records and case records, getting feedback from people, and maintaining a very positive kind of an environment, which is where there are no roadblocks, and you are functioning in such a way where you are structuring your sessions and timings in a way that you are able to function to your maximum capacity, right? But if you're working in an independent setting, or if you're working in a hospital or a clinic, accordingly your day would change. So people into independent practice, there is really no timing. So you might be seeing patients whole day, or you might choose to be working in different institutions. So you might be a consultant in various institutions and seeing patients there. If you're into a job as a clinical psychologist where you're into mostly practice, then you would be following the institution's timelines in terms of your work. Also, most clinical psychologists are majorly into psychological assessment, right? So you will be trained in psychological assessment. So you will be doing a lot of evaluation, assessment, diagnosis work, as well as report writing, for the patients that you're working with. And accordingly, then you would design and carry out interventions and take care of the paperwork, right? If you are into mostly research or teaching, then your day would be full of taking classes for students, carrying out practical activities, trainings, webinars, internships. And also you might be into research, so that would involve again a lot of reading, writing work, right? So it depends on the setting you're working in, but mostly the job of a clinical psychologist would involve some kind of assessment work to a large extent, with the use of psychological tests, and then therapeutic work, so where you would be actually carrying out interventions for mental health issues, and also teaching and training, right? Okay.
All right, ma'am. Thank you
Yeah,
so much.
welcome.
And ma'am, are clinical psychologists really work under a psychiatrist, or they are independent to make decisions?
See, again, that depends on the institution where you're working in. If you're working in a department which is headed by a psychiatrist, or where there is a psychiatry department, and you're working in the psychiatry department as a clinical psychologist, then you would definitely be under a psychiatrist, right? But if you are working in a clinic which is headed by a clinical psychologist, or which is just dealing with psychology and not really psychiatry, then you might be working under a senior clinical psychologist and not a psychiatrist, right? So depends on the kind of institution and the structure you're working under. It's not necessary all the time that you would be working under a psychiatrist. You would be working very closely with psychiatrists, because there is always a referral involved where you would be referring patients for medications, but it's not necessary that you would be working under a psychiatrist.
All right, ma'am. Thank you so much.
Yeah. Deepak, there are a lot of queries in the
Yeah.
chat box, so do we
Yes, ma'am.
answer those,
Yeah,
or?
I am just about to say about it, ma'am.
So if you can
So
pick
there's a
out
question.
few common queries and I can answer those.
Yes, ma'am. I'm getting you, ma'am.
Yeah.
So there is a question, ma'am. How to choose between Doctor of Psychology and a traditional PhD, ma'am?
Yes. So, if you are interested in practice, if you are interested in intervention work, right, actually dealing face to face with patients, then it's better to go into the PsyD program. Okay. But if you are interested more in teaching and research, then you go into a PhD program. So, PhD is about academics, it's about teaching and research more than the PsyD. PsyD is totally practical and intervention based. Okay.
You Yeah, yes, ma'am. The next question is, what is the basic difference between applied clinical psychology and the normal clinical psychology, ma'am? I think it's asked in MPhil perspective.
Yes. So I mentioned this also in my when I was talking. So applied clinical psychology or applied psychology is a branch of psychology. See, there is psychology, which is the study of all human concepts and human psychology, right? But when those concepts are applied in a practical area, they become applied psychology. And applied psychology is mostly clinical or industrial or counseling or forensic. These are the main divisions within applied psychology. Okay. So if you are doing applied clinical psychology, basically means that you're applying psychological knowledge and principles to the clinical field. Okay. So I have done a master's in applied psychology long time back from Delhi University, and I had clinical as my specialization. So that's why I got trained in a hospital setting. And my work there was to do a lot of observation, assessments, case histories, intake interviews, and also when you're training, you're not really allowed to take on patients yourself. So you really can't take on patients for therapy. So you are observing a lot, right? And only later on, after maybe 15 years of studying, only then I got into actually taking up patients myself.
Yeah. Okay, ma'am. So like you said about like there is a 100-point structure for being your license valid, right? So can you elaborate about it, ma'am? That 100-point structure.
Yes. So, if you have done an MPhil in clinical psychology, right, you are labeled as a clinical psychologist and you're technically under the Rehabilitation Council of India, which is the RCI. It is a government body which is usually accrediting rehabilitation professionals, but they also accredit clinical psychologists. And MPhil in clinical psychology as well as the 1 year professional diploma in clinical psychology, which I mentioned. Both of these require certain kind of procedures where you get a license, and to maintain that license, you need certain commitments. Okay, so the MPhil program, which makes you a clinical psychologist, requires 100 points, which you have to cover in 5 years to be able to renew your license. And those 100 points can be achieved through a variety of activities which are specified by the RCI. So I would suggest that all of you who are interested in being a clinical psychologist should really go to the Rehabilitation Council of India website, RCI website, and take a look there, because they mention a whole lot of information about relevant for clinical psychologists. And also you should visit the website of the Indian Association for Clinical Psychologists, IACP. So you will get to know the idea about the different kind of psychologists which are there. They have a number of members, and the member directory is also there. And a lot of them are working in hospital and clinical settings, some of them are working in university settings, some of them are working in research institutions, right? So you will get to know a lot about the ethical and professional codes also which are there for psychologists. So both of these websites you must visit if you are interested in clinical psychology. And the RCI website will also give you a list of accredited institutions which run MPhil programs in clinical psychology. Okay.
Yes, ma'am. Like
Yes.
Ma'am, one can get a internship or as an observer. Uh,
Yeah, of
yeah,
course.
one can get in as an internship or as an observer uh, without having an MPhil, or to be a part of a clinical psychology institution, one must have an MPhil.
No, no. You for internship you don't need MPhil. You can, after your masters, or even some places even bachelors, they are taking for internships. So a lot of hospitals, clinical settings, as well as independent practitioners, they take up people for internships. So MPhil is not a requirement for the internship. Most master students are going for internships.
Okay, ma'am. And ma'am, does it really make a difference from where did you completed your masters? like I'm pursuing from Punjab University.
I don't think so, Tanushri. It doesn't make so much of a difference, but obviously, if it's a good university and if it's a good program in terms of the number of papers, the type of papers you are studying, and the the kind of faculty that is teaching you, their credibility, their experience, and also the exposure that they give you to the practical side, to the internship side, the kind of labs that they have, the kind of research opportunities that they have makes a whole hell lot of difference. So if all these things are good and proper, then it's a good university, great program. Yeah.
Okay, ma'am. Thank you.
Hmm.
Hello, ma'am.
Yes.
What are the basic skills a clinical psychology should possess?
What are the basic skills which a clinical psychologist should possess? Okay, so you are saying what are basic skills which you need to become a clinical psychologist, or once you have become?
Once we have become, it was asked in a lot of comments. What are the basic skills a
Yeah.
clinical psychologist should have
Okay, so I'll
after
answer
we have
it. I'll
become a
answer it.
psychologist?
Yeah, I'll answer it both ways. So if you want to decide whether you want to be a clinical psychologist or not, right? That is, I think, what you're asking. So if you are very interested in treating people, in dealing with patients and carrying out interventions, okay. If you are really interested in the mental illness issues, and if you are interested in doing assessments and doing reports, and if you are really interested in working with people who have mental health issues, then you know that you're fit to be a clinical psychologist. So you have to be having good communication skills, especially good listening and empathic skills, where you're able to really empathize and put yourself in another person's shoes. Somewhere you also need to be very sensitive, to be able to help another human being out, and you need to be confident and mentally healthy yourself, okay, and ready for a lot of hard work, because you are going to be a mind doctor, a mental health doctor, okay. And once you are a clinical psychologist, then obviously you need to have a lot of skills which have to be updated all the time, right? So your studies will give you a lot of skills, but on a daily basis, on a regular basis, you have to upgrade your skills by attending various programs, workshops, courses, and through experience also you accumulate a lot of skills over time, okay.
Renuka Simons wants to say something. She's
Yes,
been raising her hand. Please
sure.
unmute yourself, Renuka.
Yes, yeah, thank you. Ma'am, I wanted to know, ma'am, you had mentioned about the diploma that you can do after your master's, right? Hello.
Yes.
Yeah. So, ma'am, I just wanted to know, like, what's the main difference between getting a RCI, like doing your MPhil and doing the diploma?
Yes,
Like,
so RCI recognizes both the MPhil and the diploma. The difference is that the MPhil is a 2-year program, while the diploma is a 1-year program, right? And the difference also is that after MPhil, you can get into teaching as well. But after the diploma, you cannot get into teaching. It's only for practitioners. It's only for people who want to be licensed as a clinical psychologist and want to get into practice, clinical work.
all right, ma'am. So it's nothing like if you do your diploma, it's like a lower thing as compared to MPhil.
No, no, absolutely not. Lower nahi, but it's a shorter duration and there is a focus. It's for basically practitioners. While the MPhil, you can practice, you can teach, you can get into research. So there is more scope if you do
Mm-hmm.
the MPhil, and the scope is limited if you do the diploma. Right?
All right, ma'am. Ma'am, and ma'am, do you know of any colleges that offer this course, this diploma rather?
Like I said, you go into the RCI website and you'll get a list of institutions which offer both MPhil and the diploma.
All right, ma'am. Thank
Yeah.
you.
Okay. What else?
I have a doubt. So regarding the clinical and all, during the situation, we can't do some case studies and all. It's kind of difficult during this pandemic situation, ma'am. So in order to learn learn our own by referring to certain books. So how do you suggest, like, in what way we should be keeping our mind open towards learning and how it is
Right.
being absorbed in us so that we can, do it better when we reach out?
Sure. So, Joel, that's a very good question. And I always think that knowledge, skills, as well as the right attitude is very important. So, no doubt that you have to read up. And I would suggest that you read a little research, the latest research which is there in clinical psychology. That's one thing. Secondly, you can watch stuff on YouTube. So, YouTube doesn't have real patient and doctor kind of situations, but they have role plays. They have role plays about different therapies, about counseling, and about even doing a lot of assessments and rehabilitation work. So YouTube is a very good resource in which you can look at some videos of actually stuff going on. You can see sessions happening, but they are mostly role plays, like I said, but very good ones. Okay, so that is another thing. Thirdly, you can attend webinars and workshops, and fourthly, you can go in for internships. There are a lot of people and institutions who are offering internships where you may not get to actually work with clients, but you may get to discuss case studies, listen to them, maybe also do some observations of sessions and role plays, definitely. Yeah.
Sure, ma'am. Thank you.
Ma'am,
Zara, Madhya, you can
Hello,
actually.
ma'am.
yes.
One second.
I
I
can't.
Zara?
think Zara, she has a
Yes.
question.
Yeah.
What's that?
No, ma'am, like a person called Zara Madhya is raising hand, so she wants to ask a question,
Yes,
I guess.
yes, Zahra, please
Please
go on.
unmute yourself, Zara.
Excuse me, ma'am.
Yes.
Ma'am, I just like to ask, like, do you know any internships name as such in clinical psychology, or like, are you conducting any of it at present?
I offer a free internship, right? But that is not really clinical psychology as such. It is more of cognitive behavior therapy. It's a very specialized internship where you get to learn basic CBT skills, research skills, as well as you get to do a lot of various other tasks such as content creation, social media management, networking, those kind of issues. But I do teach CBT, cognitive behavior therapy, in my
Oh,
institute.
Please know
Yeah.
something
okay,
about it.
ma'am.
Like, how can we apply to it?
But yes, lot of clinical psychologists who are into independent practice are offering internships. Okay, so you can be on LinkedIn, and most people really most professionals are on LinkedIn. So LinkedIn is a good way of getting to know about internships and things. And also there are various WhatsApp groups and as far as I know, even Facebook groups which you can join and get to know about internships which are there. And especially if you're living in a particular, area of India and a particular city, it's a good idea to approach your local institutions and ask whether there are internships on offer there. Okay, because it's highly competitive and most people usually have a limited amount of seats for internships. So they usually prefer people from their area or neighboring areas, right? So it's a good idea to find internship opportunities within your geographical area also.
Ma'am, can you share details of how can we join the program you offer?
My program is there on LinkedIn. I keep advertising on LinkedIn, but you
We'll be sharing all the contact details of Nimisha
can,
ma'am,
so you
so you guys can get in touch later.
sure you can write to
All
me
right.
and I yeah,
Thank you,
Yes,
ma'am.
ma'am.
Thank you, ma'am.
welcome. Yeah.
So I guess it's time to conclude the session. So thank you, Nimisha ma'am. It was such a wonderful session. I really knew a lot about clinical psychology, and the way you presented the PPT was so much structured in a way that each and every detail is not yet missed. So
Thank you
thank you
so
once
much,
again,
Joel.
ma'am. So yes, ma'am. Thank you.
It
So
was a
I'll just ask Deepak to present a certificate for you.
oh, that's nice. Thank you.
So,
Oh, thank you
so
so
I'll hand
much,
over to
ma'am.
Deepak.
Thank you for joining us.
My
Yeah,
pleasure.
am I audible, Joel?
Yes.
Yes, Deepak, you are.
Yeah, thank you so much, ma'am. Thank you for joining us, and it was really a wonderful session, ma'am. We actually learned a lot about the clinical psychology, and also you patiently you explained a lot of our doubts. So thank you so much, ma'am. and we will be sharing your details in the
You're
WhatsApp group
most
also,
welcome.
ma'am.
And I
So
would
thank
just like
you.
to say, if any of you have any queries, you can connect with me on email or LinkedIn. I totally welcome any queries and any way in which I can help. Right? Okay. Thank you so much.
Thank you, ma'am.
Thank you.
So now, as the session is over, we'd like to move upon to call Nishi, national leader, to talk about regarding the benefits of the college leaders and also their tasks. So Nishi, you can start.
Yeah, thank you, Joel. So, hey everyone, how is everybody doing?
Really good.
Okay, so is this internship satisfactory for all?
Yeah,
Yeah.
absolutely.
So, okay, so as I have, like, as Irfana had previously told, that 3G is not just, we are not just limiting up to the internship, we have so much more to offer. So, we are planning to host India's largest psychology conference. You guys must be knowing about it. So, for that, we have, like, we'll be giving you tasks. So we are planning to give you task. In that task, you have to, bring registration. So you can share about the details to all your friends and families and stuff, and people who are interested in this can register. So I'll teach you how to register. So that Deepa, can you make me the host so that I can share my screen?
I'm not the host.
Yeah, Joel. I guess Joel.
Yes, Nishi, I made you. Guys, so one more second, the feedback form has been posted in the chat box. You guys can fill in the chat box feedback so that it is an attendance for attending the internship today's session. So Nishi, continue. Nishi, you can press on the screen.
So see, this is the website, and here you just have to, become a volunteer first. So if you fill all your details, I'm sorry, it's loading. So if after you fill all your details, you'll be getting a mail, and in that mail you will be getting a referral ID. So everybody will get a referral ID, and we will be checking individually that how many reference you can bring. So we will be checking that. So after you fill all the details, you'll be getting an ID like this. You'll get a mail like this, something like this. Welcome to 3G, and you'll get, just a second. You'll get like this, and you'll get a name, and you'll get a referral code which has been mentioned down. So after you get this, you can, share it to the people, and you make sure that you share your own referral code. So we'll be checking that how many people are registering under their referral code. So this will be your main task. I hope I was clear.
So guys, do you have any doubts? You can ask in the chat box.
If
So
you
What
the
have
we're
any
trying to
reason,
doubts,
do is, yes, Deepak.
yeah,
if you have any doubts, you can ask here.
Okay.
yeah,
Yeah.
and also
The
one more
reason.
thing. Yeah, you will be
Go ahead,
given,
Nishi.
like, every day you have to bring at least 10 registrations. 10 registration is the minimum bar limit, and after every 1 week we will be checking the dashboard, and we'll be finding people who are not doing the job. So guys, we have been offering you so much things: free internship, free certificates, free activities, and we really want, to this message to be spread all over the, like, all over the places, and we want people to, come and interact with us and get to know about us. So guys, please, start taking this job as seriously as well. So me and Joel will be tracking down, and we'll be finding people who are not doing the work seriously. So as a state leader, you guys have lot and lot of benefits, which I've like mentioned earlier. Also, you'll be getting lot of certificates and stuff like that. And also the college leaders, you will be also getting lot of stuff, which includes the certificate, letter of recommendation, virtual kits, and lot many benefits. So if you are getting everything for free, and if you're not doing your job, that's not a done deal, right? So you guys have to, start taking this job as seriously. So if you guys have any doubt, you can ask me, Joel. You can pin me anytime on WhatsApp, and me and Joel will be monitoring this task.
So thank you, Nishi. So I would like to tell us a few things. Because on January 13th, 31, we are conducting this biggest international psychology conference, which is for free, and we are not asking anybody to pay anything. So for that, what we are trying to do is we want to make a maximum share from each one. There are a lot of network and contacts regarding people who are doing psychology and also working in psychology field. So it will be really help you. Yes, you can also join foreigners too. Now outside India, it's going international, like all across the globe. So we've been trying to connecting with people from UK, Hungary, and Algeria. So it's free. You can just share it to anybody across anywhere. So will be getting with the referral code that you have, we'll be tracking on the registrations, and the person who is getting the maximum registrations will be getting a surprise at the end.
Yeah,
So any doubts you guys have, please type in the chat box, or you can also unmute yourself and it's just a free conversation.
there is lots and lots and benefits, and the person who's getting maximum registration will also get something from us.
Hi. So I wanted to know about that assignment you mentioned earlier.
Yeah.
So like I didn't
The
get any
assignment
work.
regarding the internship or the task that we are giving?
No, regarding the internship.
Okay,
Yeah,
Deepak.
first you have to fill in the feedback form, and then I'll be sending you a email. It will be about joining the Google Classroom, and then you can see the assignments there in the Google Classroom.
Okay, thank you.
And Lakshani
Yeah.
Priya, I guess. So you will be getting your referral code through mail. Like when you register, you have to register as a volunteer. After you register, you'll be getting the referral code, and make sure you share your referral code to the people. Okay.
So if you guys have any other doubts, you can just ping me in WhatsApp, me, Nishi, Deepak, or Harini in the group. If you guys have any doubt, it'll be automatically cleared. Share the website, sure. The link will be
Yeah.
shared in the website,
Link
and
will
you
be
guys
shared.
can send it across anybody who can participate. Like it's no need that no, it's not restricted to psychology people alone. You can share it to your friends and also your family. Let everybody get this amazing opportunity.
Sir, if you can share the link again in the WhatsApp
Sure.
group regarding the feedback form.
The feedback form link
That
and
would
also the
be
website link will be shared right now. And for the
thank
feedback form, I request all of you to fill it within 10 to 15 minutes. We'll be closing the responses. So I guess we have addressed everything. Deepak, anything else to add on? Or
No, that's fine.
okay, Deepak. So we'll be ending the meeting. So thank you all for your participation. So from today, it was an amazing session. From tomorrow, there'll be various yet another interesting sessions. So thank you all. You guys can leave the meeting. Bye bye.
Yeah, the conference is
Yeah, the
for free.
conference is free.
Okay, thank